Today I'm going to be talking about caring for older adults residing in institutions. Why is it important to have good dental hygiene in a care home? I would say the number one reason is it's very hard to get these folks to a dentist, either for a regularly scheduled cleaning or for pain. And this means that the mouth can become painful and stay painful, which affects chewing and nutrition. And then just maintaining comfort is very key for these folks. Possible diet changes may also cause changes in the mouth and body. Really watching that increase in carbs and sweets in addition to the cheap meals they're being fed. They're possibly snacking all day just out of boredom, as a lot of these places do not have the activities that are interesting or sustainable for these folks. They may be switched to more of an inflammatory diet than they were normally eating at home, that lacks of fresh fruit, fresh vegetables, or they're unable to eat these fresh fruits and vegetables because of a painful mouth. Also, the loss of autonomy and mobility once these folks reach the care home. They're unable to go where they want to go without help. They're unable to get their hands on the things that they love. Maybe they aren't able to get the toothbrush that they're looking for or normally use, or mouthwash or toothpaste. They're kind of at the mercy of other people to get their healthcare items and also their personal items. The staff at these places are not always as educated as one might hope. CNAs are instructed to never put their fingers in a client's mouth. This causes the idea of flossing to be thrown out the window. While some nursing textbooks state the proper brushing and flossing protocol, there's no way that one person can brush and floss that many clients as many times as they need daily. It just doesn't allow it. Oral care is also easy to neglect because no one notices when it's not done. People notice that residents aren't wearing socks or they've soiled their brief, but they do not notice that their teeth are not brushed. The role of the dental hygienist or student dental hygienist is so important with folks in the care home because they can provide treatment that is under the scope of an EXP3 and ECP3 and working closely with the DDS to diagnose and treat minor discomforts. This allows the client and family ease as no transport is necessary. Also, the dental care is mobile and can be set up in existing beauty salons on site. Having someone come in just to brush their teeth once a week is ideal, as staff can be on hand to possibly watch and be encouraged to continue brushing and can alert the dental professionals if any problem areas, and this allows for one-on-one time with the dental hygienist or student dental hygienist. I think it's important to implement in-services, helping CNAs to easily address oral care, and they should be provided biannually due to the turnover at the care units. These in-services should address positioning the client, brushing the teeth of a client, how dental care can increase the quality of life, and can cut back on mouth odor, and then also some information on just how to care for dentures and also for partials, and why are the CNAs working to decrease inflammation, how to help identify tooth decay, how to help with dry mouth, and the introduction of xylitol into the daily routine. Caring for dentures and partials is especially important because a lot of times folks will get aspiration pneumonia because in their sleep they have aspirated rotting food that's caught under their denture or their partial. aspiration pneumonia is a very serious issue in a lot of these care facilities, simply because of lack of care. And I'll say lack of knowledge, but lack of care. Specifically, why is a healthy mouth a healthy body? Periodontitis is a risk factor for certain systemic diseases, which we just covered. P. gingivalis was found in samples of deceased people with and without Alzheimer's, but most commonly found in Alzheimer's patients. Strong evidence to date that this bacterium may actually contribute to the development of Alzheimer's. P. gingivalis is also linked to rheumatoid arthritis and, again, that aspiration pneumonia. I think that it would be worth it with the help of your dentist to even go as a dental hygienist, to go to a care home once a week just to brush people's teeth, kind of hang out in their mouths, get familiar with what kind of work they have, just to help increase awareness that someone does care. Advocacy for these folks is huge. These are two lovely folks who, in their later years, deserve to have their work preserved as well. This is my grandma and my grandpa. My grandpa has periodontal disease. He also has a partial that replaces quite a few of his upper teeth, and he might have a lower partial. I just can't remember that. About 4 years ago, his dentist that he'd been seeing recommended that he have all of his teeth extracted at the age of, I'm going to say, it was 88 or 89. And Grandpa refused and then promptly changed his dentist. It's not good for anyone. Why would you remove all the remaining teeth of a person, good quality teeth at that time, and replace them with dentures for your convenience and the convenience of your staffs? This fine lady is my grandma. For the longest time, number 8 had a 3/4 gold crown that she was very proud of. We have since convinced her to do something different, but she too deserves every crown, every filling to be preserved. She paid for it. Finally, I have one of the sweetest ladies on the planet. Well, she no longer is with us. 104 years old is when she passed, just 2 weeks shy of her 105. This is Miss Betty Moore. She did have a lower partial, but she didn't wear it. It was pinchy, which totally can happen. And I feel like because she had it out so much is why it continued to be so pinchy, even after several adjustments. When she passed, had over 75% of her teeth, and that is because she was well looked after. Her mouth mattered. The mouth and body were a link. Thanks for your time today. I hope that you've learned something, and I hope I brought a little bit of passion for our folks that deserve the most love. And there is my source slide. Thank you again.